Hello, today we're going to talk about appraising validity of intervention studies. Last time we looked at the 4 steps of evidence-based practice and how to form a focus question. Once we've formed a focus question, what do we do next? Okay, I'm going to pose that question to you again in a little while. First of all, let me explain what we mean by an intervention. Now, most of you, I'm sure, will think of treatment, whether it be medical, surgical, or psychological, something that a health practitioner does for a patient. But actually, preventive services such as screening for cervical cancer, educational activities such as teaching people how to manage their asthma better, are also interventions. But then so too are changes to the way our institutions work, and for public health campaigns attempting to change people's behaviour. Now let's recap where appraising the evidence comes in. We start with a focus question. We search for and acquire the evidence, and then we appraise it. And you remember, by appraise we mean judge it. And we judge the evidence for its validity and its importance. So let's revise. What do we mean by validity and importance? You might want to pause the slide here and write down your definitions before comparing it with ours. Right. Importance refers to the size of the effect. Now, in a trial, we've often given one group a treatment, an exposure. Intervention here means exposure. The other group is the comparison group. And we look at the effect of the treatment. It may, for example, be the cure rate or the death rate. And the difference between the two groups is the size of the effect. Validity, on the other hand, refers to the quality of the study, how it was designed and conducted. And we want studies that are of high quality, that is to say, that have a low risk of bias, so that their results are reliable. When we come to appraise a paper, the first thing we want to do is to ask ourselves if it is worth giving up some of our valuable time to read the paper. What is of vital importance here is whether the paper addresses the question that we started with. So we want to know, what is this paper about? How do you think we might do this? Pause and think. Well, the answer is, we look at the aims and methods of the paper, which should be in the abstract, and we turn those into a pecot, just like the pecot we started with. And if the two match each other, then it's probably worth reading. But before we do that, we must also ask ourselves, is the study type appropriate? And that's what we're going to ask ourselves next. What kinds of study are appropriate for appraising a paper about treatment or intervention? Okay, what kinds of interventional studies do you know of? Okay, open trials are very rarely done. This is where there is no attempt at control or blinding. There are randomized controlled trials, and these, I'm sure, are the ones that you're most familiar with through your reading. We'll spend most of the time looking at these today. As you know, in a controlled trial, one group is given the exposure and another group is the control group. All the factors that might influence the outcome, except for the exposure, are controlled. Then there are pragmatic trials. You probably haven't seen many of these, but this is where there is looser control. Let's say, for example, physiotherapists treating back pain want to know if early back pain is more effective than, early back pain physiotherapy is more effective than usual family physician care. Some physiotherapists tailor the type of exercises they give specifically to a particular patient's symptoms and signs. In a pragmatic trial, you might allow the physiotherapist to vary the treatment according to the patient. In a more controlled trial, you might insist that they all use exactly the same advice, exercises and information leaflet. Then there are before and after studies, which you won't often see, but are suited to studying changes in organization. So let's turn now to assessing the validity. We've looked at the paper, we've decided that it answers our question, we've decided it's the appropriate type of study, and now we want to know, is this paper valid? And assessing for validity is a battle against bias. What do we mean by bias? Okay. Bias does not mean prejudice or fraud, nor does it mean random error. Now let's see what we mean first of all by random error. Supposing I were to give a particular medication, such as an anti-inflammatory, to somebody with back pain, and I gave a comparison group something like paracetamol. Let's suppose there was only a small number in each group, say 5. Let's supposing after a week, 4 out of the 5 people who took naproxen were completely better and none with paracetamol. Now the numbers are so small that could have happened just by chance. It could have been just chance that the people who had naproxen were suffering from a short-term strain, whereas the others had a more serious strain that would go on for longer. That's random error. Bias is not random. There is a fault in the design or the conduct of the study or the analysis that pushes the results in the direction, in one way or the other way, in one direction or another. For example, supposing in our back pain study with anti-inflammatories, we gave the people who are on anti-inflammatories a leaflet warning them about the dangers of anti-inflammatory tablets and to report to their doctors if they get indigestion. That group would know that they were having the active treatment, and the difference we see between the two groups might just be a placebo response. So the difference between chance and bias is that chance is random error, whereas bias is systematic. If you have a really large sample, random errors will cancel each other out, but bias will not, because it's systematic. Okay, so what are the kinds of bias that we see in a paper on intervention? Again, you may pause the button here and write down the types of bias that you know. Let me put it slightly differently. Where do you think a study about treatments or intervention might go wrong that would lead to results that were untrustworthy? Well, here they are. There are far too many for me to go through each one of these individually now. Let's just concentrate on one: contamination. I'll give you an example. When ACE inhibitors were first introduced for the treatment of heart failure, studies were conducted in which patients already taking diuretics were given either an ACE inhibitor or a placebo. Neither practitioner nor patient knew which one they were receiving. But ethically it was felt ACE inhibitor treatment could not be withheld from patients if their clinical need their clinical condition worsened during the course of the study. So the practitioners were allowed to add an ACE inhibitor to the patient's treatment, whether it was an ACE inhibitor already or a placebo. So there was contamination. Now this would mean what? It would mean that the patients who were having placebo were now getting the active treatment. Therefore, we were no longer comparing active treatment versus placebo. What effect do you think this would have? Well, this is a form of bias that would tend to reduce the size of the effect. It would not give us a reliable answer as to how good ACE inhibitors are. The final step is to ask ourselves whether this study that we're reading makes sense. When we ask, are the conclusions compatible with the findings, there are two things we are doing. First of all, we're asking, do the results match the conclusions that the authors are drawing? Or are the authors perhaps bigging up the meaning of their results? Secondly, are the arguments they use logical or not? The final thing we ask ourselves as clinicians with experience and expertise is whether what they're saying makes sense for us. For further work, I suggest you look at your course book, Chapter 3. There you will find more information about the types of bias that can exist in interventional studies. You'll also find some examples there. Online, I have posted an imaginary study called the Kant study. It has biases purposely put in there. Please appraise the paper to see how many you can find. Thank you.